It affects people of all ages, children as well as adults. It's more common in women than men. It's fecal incontinence. Dr. Phuong-Nguyen of Hoag Memorial Hospital Presbyterian in Newport Beach discusses the causes and treatments for this condition.
Fecal incontinence occur from either prior vaginal deliveries, childbirth injuries, prior anal surgeries, patients with neurologic conditions, spinal cord injuries, patients with diabetes. Those are the patients who are prone to the condition. The symptoms vary in severity, and a lot of the patients do not bring up the topic to their physicians. And there was one study that showed that about 90% of the patients with fecal incontinence, the physicians are not aware of the issue because the patients don't bring up the problem. So physician awareness is very low. The patients are embarrassed to bring up the symptom. Really, any even minor symptoms should be brought to the attention of the physician so that we can evaluate it, we can understand it, and hopefully we can improve patient symptoms. The symptoms are very debilitating, they're incapacitating. Patients have anxiety and fear because of the symptom, and that leads to low self-esteem, social isolation, and patients just lock themselves at home. There's difficulty in maintaining employment. Here at the Hoag Endoscopy Center and Gastrointestinal Laboratory, we have the different diagnostic tests that are available to diagnose a condition, to understand the process, understand the symptoms. Depending on what we find on the diagnostic evaluation, we start off first with simple measures. We use patient education. For example, if the patient has constipation predominant symptoms, then we can use different ways of improving their bowel pattern. For example, fiber supplement. If the patient has diarrhea, we can control that by using an anti-diarrhea medication to decrease their fecal incontinence symptoms. We also train the patient to do timed toileting, meaning going to the restroom at a certain time during the day, and also for complete emptying, meaning they need to empty their bowels completely before they leave the restroom. Next step, we have programs that offer biofeedback. There are treatment sessions that we use to educate the patient to improve their sensory in that area, improve their functional capacity in that area. And they're typically 1-hour sessions. We train them for a period of 6 weeks. So they're biofeedback training sessions. And we try to help the patient improve their symptoms. And studies show that there is some improvement in patient symptoms and quality of life. Of course, there's always surgery to repair any sphincter defects, any muscle defects in the anal canal. That's always something that we consider as the last option, surgical therapy. I think that the problem in the condition is a significant financial burden to the healthcare community. And if we look at the data, patient costs are significant. So we really need to understand this process a little bit better and recognize the problem in order to help the patient.